Hello, my name is Selena Benio, and this is my persuasive speech on pro-euthanasia. Imagine being in pain and suffering on a daily basis. Euthanasia, also known as the good death or mercy killing, is a way for a suffering and dying person to end their life mercifully and also relieve the financial burden on their family. There are two types of euthanasia I would like to discuss. First, active euthanasia. This type can be administered when a physician would perform on a patient a lethal injection or providing a patient with a lethal combination of medications which they may take on their own when they decide to end their life. Example: in November 2014, a terminally ill 29-year-old wife moved to the state of Oregon to have the right to die under the Death with Dignity Act, which means she can die on her own terms. She had to become a legal resident of Oregon in order to accomplish this. Oregon is one of the few states in the U.S. that has made it legal for a patient to decide to die of a lethal prescription of medications which they administer to themselves. The patient had terminal brain cancer with only a 6-month chance of survival. Second, passive euthanasia. This type can be administered when someone dies by either no medical treatment or taking away life support equipment such as a respirator or a feeding tube. Here is an example. A child is born severely ill with no chance of survival. If the baby is put on life-saving ventilation, it will still not survive and will suffer by suffocating because the brain cannot regulate the lungs. With the assistance of a doctor and medical staff, the baby can be euthanized mercifully and morally to keep from a prolonged, needless suffering. Euthanasia should be used for the most severe patients, and I believe euthanasia is justified in these cases. The quality of a person's life is more important than the length of life when the patient only has a short time to live. Death is morally justified, ethically acceptable, and a good medical decision when a person is severely suffering. I am a pro-euthanasia advocate, and I believe that people have the right to autonomy and a right to die at the time of their choosing in order to die with dignity, avoid healthcare costs, and relieve the burden on their family. In my conclusion, my position on euthanasia is that I believe it is moral, ethical, and justified under the right circumstances, and for patients that are suffering. For those that oppose euthanasia, I hope and pray they will never be in a position of suffering and experience the true effects of a person's wishes to die. Just because you would not choose euthanasia, you shouldn't stop someone else from making their own decision. When dying is the wish of the patient, why force the patient to live? While waiting to die, the patient is stuck in a hospital bed with no way out of the horrible circumstances they are left with due to disease or even old age. You are a prisoner in your own body. These patients know the pain they are going through, so they should be the one to decide to die, or their family should make that decision for them if they are incoherent. We should all be working together to make human euthanasia legal. Please go to the deathwithdignity.org to join the movement, learn more, and take a stand for Americans to have the freedom to choose. Thank you.